Is it live streaming on?
Sir, I'll start the live streaming now.
Yeah, start the live streaming. चलो प्रवीण सर स्टार्ट कर लो.
Yeah. Am I audible?
Yeah, very audible.
Right. Good evening, dear friends. This is a very, very important day for all of us from NJH for one major reason. Because we would have seen and heard our all ladies meet once. Now today all gents meet once. Today is very important for all of us because all gents is a very auspicious day, right? And the topic is very dear to everybody. And as a homeopath, everybody would have had hundreds of successes in treating renal calculi patients. And of course, we have our great giant, Dr. Asani ji, who will be talking about the renal calculus, its diagnosis, and all that. I tell you, before we go on to Dr. Asani ji, today our panelists are so great. Dr. Asani, of course, everybody knows. Dr. Kritik Shah himself calls him as son of Hahnemann, proud son of Hahnemann. And we have Dr. Pradeep Garge. In that part of the country, Aurangabad, he hails from. And he is a very great practitioner, academician, has tremendous following and great success. When I was studying intermediate, one of the lab technicians was cleaning his rice, and without us asking him, we were 4 or 5 friends, he said, I am very careful in cleaning the rice before I cook because there should not be even a single stone in the rice. Otherwise, it would cause kidney stones for a man. The new intermediate. I was so scared to eat rice. I may get a stone in the rice and develop kidney stone. I'm just giving this example from my side to tell you that there are so many misconceptions, problems. Among the lady, okay, but among the even many people. So,
Praveen sir, your voice is not clear. Please check your connectivity.
Oh my God. I think it is full now. Do I have to do anything?
Yes, now it is clear. So
now audible, now audible.
Probably I may have to come nearer to the mic, probably. Okay.
Yes.
Okay, done. So, to quell all these doubts, misconceptions, I would invite our first panelist, Dr. Asani ji, to throw light on the clinical aspects of renal calculi. Dr. Asani ji, the mic is yours. Sir.
Thank you. Good evening, all. So, clinical features of stone, a renal calculus or a calculi, whether it is renal, ureteric, or vesical. The first symptom is that they are largely asymptomatic. Unless they are obstructing the ureter or they are big enough to obstruct in the pelvis. Why does people get pain due to renal calculus? Ureter is a muscular tube, and when a stone gets stuck there, the flow of urine gets blocked. The smooth muscle of the ureter tries to push the stone forward so as the flow to be established. That contraction of the smooth muscle gives you ureteric colic. Renal stones are generally silent. Vesical stones are 99.9% silent because the bladder is so big. The stone can become 6 centimeters and still it will not cause any pain. Second symptom is pink color urine. It's never frank hematuria. It is light urine, and when you see a routine urine examination you do for a suspected infection and you find more RBCs than pus cells or WBCs, that is your first suspicion that there could be a calculus. So pain could be vague abdominal pain, could be loin to groin if it's the ureteric calculus, could be just in the region of L1 vertebra where the kidney sits. And if you have a patient with vague pain and you've done an ultrasound to pick up the cause and you find 5 non-obstructive stone, please do not tell the patient pain was because of calculus. Still look for cause of pain because these calculi were not causing any pain. Then when the pain is very acute, when the stone is really obstructed, patient will get nausea, they may get vomiting, and they may perspire. The pain is so severe. We would say, I would go to the length of saying, pain of ureteric calculus is as bad as myocardial infarction. It is lower down. Same symptoms, extreme perspiration and uncontrolled vomiting. So the main thing is that you have to suspect, and then once a stone former, always a stone former. So if a patient says, I had a stone 10 years back and I passed, after that nothing, you say, okay, so you not got a pain after that. Do an ultrasound or X-ray to find out. Praveen sir, this is the only thing I'll talk about the symptoms, clinical features. You are on mute. You are on mute. You are on mute.
Right. Am I audible now?
Yeah, now you're audible. Yeah.
Yes, sir. Thank you very much for showing us the way, how do we go into the clinical aspects of renal calculi. And now, many of us, as homeopaths, would have encountered with these renal calculi without. Senior physicians, homeopathic doctor, Dr. Pradeep Garge, to throw light on this renal calculi and his experiences, especially in that area where calculi cases are more, I believe, because I was told several times in the college when I was doing PG. So I request Dr. Pradeep Garge to throw more light on this aspect from homeopathic perspective.
Sir, I have not got the question basically because it was all breaking.
Okay. I'll ask you again. Please throw more light on renal calculi cases from homeopathic point of view, as now we got the clinical aspects from Dr. Asrani.
Yeah. Basically, if we think of this renal calculi, it is all depends on the diagnosis, how we are going to approach to the case of a renal calculi. Number one, most of the time, patient comes to us either in 2 cases. Number one, in acute condition, if he is a family patient of you, then he will come to you. Otherwise, he comes to you after a diagnosis, which is made by a general physician or by someone. And then he thinks that it is a good time and it is a good way to treat these calculi by homeopathy, because they don't want to go for any operative procedures. as they are not interested in operative procedures or they are not aware of what exactly how they can be treated, they come to homeopathy. So when we are treating homeopathically, we have to think of the first, number one, whether we can treat these patients which is in front of you with homeopathy or not. It totally depends on the size of the calculus. If it is a staghorn calculus, that means which is totally embedding the pelvis, and it is the kidneys are totally embedded with that calculi, I will straight away say, no, this is not a case which is to be treated by homeopathy because it is a staghorn calculus. This is, one must keep this in mind, whether to take that case or whether not to take that case. So that is the first thing. When you think that the patient is having these small stones which can be treated with homeopathy, then we have to have a constitutional way. There are two types which I go for. Number one is constitutional type, where we have to find out a constitution of that patient properly by taking the case. And another phase, which is an acute phase, where we have to treat the patient in acute condition when he has got severe pain. The acute episode is most important, because if you can treat that acute episode, then the patient will believe on you. Otherwise, it is very difficult. The treatment of the acute episode entirely depends on whether the pain is on the which side, whether it is right-sided or left-sided. If it is right-sided, we have got different type of medicines, and if it is left-sided, we have different type of medicines which can be treated, which can be given to the patient, and they can be given in lower potencies and can be repeated. But we have to find out exactly the location. If we can have the location, if it is in the ureter, then we have got different medicines. If it is in the kidneys itself, then you have got different medicines. So the urolithiasis, which we call as, actually, when it is in the kidneys, it is nephrolithiasis. So this urolithiasis we have to treat properly with proper investigations. That should be the most important thing which we must have. Otherwise, what happens most of the time, it is said that no, we are not done for it. So find out exactly what is the location of that calculus and what is the size of that calculus, and depending on the side, then we can proceed for the medicines for the homeopathic treatment. And then the third phase which comes is the interparoxysmal treatment, which is very important for us. So in this way, we can go ahead when we are treating homeopathically.
Thank you. Thank you, Dr. Pradeep. So he has also mentioned very clearly there are two aspects. Yeah, Dr. Asrani ji, I'll come to you.
I want to add one sentence on
Yes, sir.
which stone not to treat homeopathically.
Yes,
Can
please.
I add now, or that
Yeah,
should be
please.
subsequent?
No. Right now it would be better
We can
because it is in
continue
the
it.
flow.
Yeah.
See, an obstructed stone gives back pressure, and you see in ultrasound hydronephrosis, hydroureter. Most of us stop at that level. We don't see the kidney. We feel once we remove the stone, this will go away. Look at the kidney parenchyma. Has the kidney cortex thinned out on this side as compared to normal? Is the corticomedullary differentiation lost? And ask for a creatinine level. If any of these are positive, this patient already has a compromised renal function and needs that stone to come out ASAP. Please go ahead.
Right. Very good. Thank you. Thank you, sirs, for adding here at this point and giving the clarification when to meddle with the case, when not to. So we also understand that homeopathy, it is not a panacea. It has got its own scope and limitations, whether it is a case of just cold cough fever or renal failure or kidney stones. So now I would like to request Dr. Krutik Shah to throw light from organon point of view, what are all the cases which we deal with homeopathically. And where do you place these cases according to Hahnemannian classification of diseases? Dr. Krutik.
Yes, sir. According to this kidney stone, there are multiple aphorisms which can be applied directly into the cases what we see in our day-to-day practice. First, I believe is 81st aphorism and its footnote, where Hahnemann talks very clearly that anything in excess harms the patient. Anything in excess is not good for the individual. So in the life, the stresses what they get in their day-to-day life, mental, emotional, physical, anything in excess, what they live brings a kind of a change in the metabolism of the person and eventually comes up with the functional disturbance, what we say SORA, and then as a structural we have stone. Second is 77 aphorism, that is pseudochronic, where it is primarily a lifestyle disorder. Right now we have very much impurities in our food and drink. So as a result, the metabolism is bound to get disturbed. And as a result, we are seeing stones. But if many times correction of the lifestyle brings a lot of benefit in the health of the patient, and I have seen patients, provided there is no chronic miasm lurking, people are getting benefited greatly with only lifestyle advices. So that was the second point. Third, with due respect to Dr. Pradeep Garge sir has said, I personally feel that the stones urolithiasis can be placed in two categories. Primarily, what I have seen in my practice, it is of intermittent disease, that between the two colics, the patient is seemingly normal. So patient is asymptomatic between the two stones. That is typical definition of intermittent disease, where the patient has two spikes, but between the two episodes, patient is seemingly normal. So the acute phase has to be settled out with acute totality, but the chronic stage has to be settled with deep-seated constitutional medicine. And as a result, many times we get beautiful result with the medicine, whatever we choose depending upon the totality of symptoms. So this is how I can tell about what you call organoid perspective. And adding into this, the nephrolithiasis especially can land up into typical chronic disease with structural pathology as well. But as far as the urolithiasis is concerned, that is more or less these stones in the ureter can be considered into a part of intermittent disease. Thank you, sir.
Thank you, Dr. Krutik. Actually, you were telling like you wanted to differ with Pradeep, but you said the same thing what Dr. Pradeep told. Pradeep also told the same thing, like in between the paroxysms, you have to select a constitutional remedy. That's what it's like, afebrile intermittent. You named it as afebrile intermittent disorder. He did not name it. He did not name it. That's the only thing. Anyway,
there are only 4 or 5 aphorisms which can really apply here. That's why I
No, I understand. I understand. Thank you very much for throwing light on organon perspective of renal calculi, because most of the times we feel that renal calculus is a routine one, take the location, take these things and all. But the patient is suffering with renal calculus, and renal, as you rightly said, like the diet, his lifestyle. There are so many things, some drugs also, they play a major role. Dr. Asrani ji, could you please throw light on some of the drugs which cause this type of renal calculi, some diet modifications causing renal calculi?
See, people who have a tendency for forming stones, if they are forming uric acid stones, consuming too much of red meat will give them higher chances of getting a stone, or consuming, people who are forming oxalate stones, consuming too much of green vegetables, leafy vegetables, especially spinach and methi, may lead to more stone formation. That is why when you are not sure which kind of stone that is, we tell people you stop spinach and you stop red meat. But as you said about stone or pebble in rice, I would also like to reiterate here, tomato, brinjal and bhendi or lady's finger, those seeds do not travel from GI tract to renal tract and form stones.
Yeah.
There was a India famed nephrologist, Dr. Mani, about 35 years back, he in a CME told us, such a wonderful vegetable tomato, and all stone patients stopped eating. What power, what life that seed will have, na? After consuming from your GI tract through bloodstream to kidney and deposit. No. 90% of your patients will have that myth. No.
Yeah, it is not.
And thirdly, people who have a tendency to form stones, if they consume less than 2 liters of water a day, will form stones with much more frequency.
Yes, sir. One more question I asked, sir, about some of allopathic drugs which cause stone formation as a side effect.
Sir, drugs which may cause uric acid to deposit
Right,
or oxalate to deposit
right,
may cause stone formation,
right.
but such drugs are not very many.
Right. Thank you.
And we
Because,
do not take very much care into this. See, too much of taking Digene, Gelusil, all the antacids, and certain drugs which are given for HIV are known to cause. In certain places, they consume cough syrups because of the alcohol content.
Huh.
1 bottle 3 times a day. The guafenicin in that may cause it. But
wow.
otherwise, rational use of antibiotics and drugs will not cause. Krutik, I saw you smiling.
Because Gujarat
In
banned.
Gujarat, which is a dry state, these cough syrups which have alcohol 60% volume by volume are consumed 1 bottle a day. So ask your patient, are you taking antacids without doctor's permission? Is the patient on HIV medication? Otherwise, I would say let's not blame.
No, no,
The
I'm
drug-
not blaming. No, no, no. Dr. Asrani.
I'm not saying
They are
homeopathically blame. I'm
Yeah, yeah.
saying patient should not be told that, okay, your medicine may be causing it unless
No, no.
he's abusing antacids
Exactly.
and he's on HIV medication.
No, Caesar's drugs also have been mentioned as one of the causes in some patients to develop kidney stones. That's what
So
it has
see,
been
all
mentioned.
that will be there in patient who has a tendency to form
Of course,
drugs.
that's what homeopathy says, susceptibility. Krutik,
Yes,
that is
yes,
your arena.
absolutely. Yeah,
I'm
right.
not entering into it, but I'll now go to Dr. Pradeep. Dr.
Yeah.
Pradeep, would you throw a light on this point?
Before that, I will like to add some of the laxatives which are specific to ammonium urate stones.
Oh,
Especially if they are abused, then they can cause
that's what Dr. Asrani
yeah.
also told.
laxatives.
Don't abuse.
Laxative,
are-
antacid, yeah, both. But
and
one thing is there that half of India takes Ayurvedic isabgol for
Yeah.
laxation, for laxative, not for.
No, most of the Gujarati boys, they take churan.
But that's all Ayurvedic. So we'll have to go in a different zone only to.
no,
Right,
no.
right,
Also,
right,
some
right.
herbal products which are used as stimulants as well as for suppressing the appetite, especially in obese persons. They are the most important medicines which can cause actually these the stones.
This is a
So we
new
have
point.
to be very, very cautious when you are using these medicines. Herbal medicines, nothing happens. अच्छा है, सब आयुर्वेदिक है, हो जाता है. But if they are being abused, definitely they are going to cause a problem.
Yes.
And then
correct.
even you have got this highly active antiretroviral therapy. What as Dr. Asrani has said in antiviral therapy, if they are there, then they can cause the problem.
No, they have to be on that ART for lifelong, actually. Because their life is not longer, so they have to take it lifelong. Anyway, Dr. Garge, can you throw a little more focus on the repertorial point of view on kidney stones? Because many repertories do speak according to their location, the type of pain, the radiation, all these things. Can you throw a little more light? I'll come back to Asrani ji. You have to tell us about the diagnosis aspect, like the clinical investigations, which are very vital, very important. First, Dr. Pradeep.
Sure, sir, sure.
Basically, this topic of repertory will be more useful for the doctors who are listening to this, especially homeopaths, because see, we have got many repertories, but what I feel very handy and very easy when we are prescribing medicines, in repertory, the language is very different. We have to convert that into the main repertory language. So if we see, I generally go for boric, then the urinary systems, you will not get unless and until you go to the proper. Then there it is in kidneys. Then you have got calculi, which are calculi or gravel, nephrolithiasis. We have got almost 42 medicines for this. Then we have got, again, as I told earlier, that you have to think of the side. So in boric, we have got first urinary system, in that kidneys, then calculi, gravel, then colic. It is not that it is on the means the calculi is on the right side. It is related with the colic, which is there with the patient. So if he has got colic on right side, you can think of that. Or if it is on the left side, you have to think in that terms. And in only boric, it is been very clearly given the interparoxysmal treatment, which we have to take into consideration. Because otherwise, it is in other repertories, it is not given, like means renal calculi left side or renal calculi right side. It is not. It is the colic which we have to take when we are repertorizing the case, right? And then you have got another rubric which you can find in urine section, where it is given under sediment. The type of sediment, it can be a lithic acid, uric acid, gravel, it is brick dust, or it is an oxalate, oxaluria. That is being given in boric repertory. And in boning ocean, again, you have to go to urinary organs. In that kidney, it has given calculi, gravel, hydronephrosis, which sir was actually talking of. We have got some medicines when the corticomedullary differentiation is proper, there is no much disturbances in the kidney function, then definitely we can take help of this rubric, which is in the boning oceans under urinary organs as directly hydronephrosis.
Yes,
And,
thank you.
and even we can go further where the calculi is on the right side or in the left side of the ureter. We have got some different medicines which can we discuss later on.
Right. Thank you. Thank you, Dr. Pradeep. Even I really follow in my clinic on the table, Dr. Robin Murphy's repertory.
Murphy, yeah.
This is also very useful. Very. Dr. Krutik, if I may ask you one question.
Yes, sir.
Now, you said like pseudochronic, like, okay?
Yes, sir.
Now, if the patient doesn't respond well to your lifestyle modification, what would be your approach in that case?
Proper homeopathy consultation and prescribing as per the guidelines of the organ. Then there is no other way other than that, because and if there is an acute episode, we have to treat in an acute way.
True, true. Now I'll go back to Dr. Asrani ji. Asrani ji, could you please tell us what are all the important investigations which have to be thought of in a case of renal calculus?
There are two major investigations for identifying whether there is a renal calculus, or if it is there, what is the size, is it obstructing, and what is the effect of obstruction. One is plain X-ray KUB, which will show a stone only if the stone is calcified. A non-calcified stone will be radiolucent. So X-ray KUB not showing a stone does not mean that there is no stone. And end of the day, I will say what I always say, your clinical suspicion is supreme.
Correct.
Ultrasound will not show a stone. Ultrasound shows the effects of a stone. So if a stone is obstructing, little bigger, then ultrasound may show the back pressure and its effect on the hydroureter, hydronephrosis, which X-ray cannot show. So ideally, it should be both combination of X-ray, KUB and ultrasound. Make sure patient is not constipated, has had a clear bowel movement. Otherwise, we don't want both reports coming with lot of bowel gas seen and money wasted. No radiologist repeats free. And if both of these are negative and your clinical suspicion still says, nahi, there is a stone, then I will say CT IVP, which is a dye study. Before that, you have to do a serum creatinine because the patient is going to be given a dye.
Right.
But before I want to subject my patient to the cost of ultrasound and KUB, if a patient comes to me in acute stage, doctor, severe pain, if I have a lab connection, I will do a routine urine then. If I don't have a lab, I at least start keeping urine containers in my clinic. I'll tell him pass urine sample now and get it checked. If he said I had pain yesterday, but now I'm fine, keep a container. The first urine you pass after you get pain, you collect the sample. If that shows RBCs, then it is worthwhile spending money on ultrasound and X-ray KUB. And creatinine, if you feel that kidney function is compromised, or if you're sending for CT IVP. You do not require any more kidney function tests or CBC or anything else. There's no need to do profiles like calcium, phosphorus, uric acid now, till the stone has been removed and histopathology done. Then if the patient is, suppose you are very confident of your medicine and now the patient says pain has shifted to urethra, then the stone is about to come out. I will tell that patient, buy a tea strainer and every time pass urine through that, because I don't want to lose that stone. I want to send it for histopathology. And based on histopathology, you will decide your remedies and you will decide the diet restriction. This is all for investigation, nothing much.
Thank you. Thank you very much. One more point to be added to Dr. Asrani's investigations list. List means I'm not swelling it up, but the thing what he mentioned very clearly, like the gas shadows, and most of the doctors, they write charcoal tablet, vegetable charcoal tablet one night before taking KUB X-ray. But in my homeopathic practice, I ask them to take 1 dose of Carboveg 200 and take the X-ray. That would give a clear picture of X-ray KUB without any gas shadows. Anyway, Dr. Pradeep, you were mentioning about the sediment in the urine chapter. Did you ever take the help of these things depending on like struvite stone, calcium oxalate stone, uric acid stone? Did you depend on the analysis of stones and then prescribe the remedy?
Yeah, definitely. Because basically, if it is a calcium oxalate crystal or calculi, then definitely calcium metabolism is at stake. And our medicines like Calcarea carb or Calcarea phos or whatever the constitutional medicines coming, unless and until you give that medicine, I have never achieved a very good success in my practice. So Calcarea carb, if it is a calcium oxalate or some related with calcium, then it is must. If it is due to some uric acid, then you have to give some medicines which will treat it like colchicum. If you don't give it, then it is very difficult that the patient will get 100% cure or whatever, means he will not get total relief, what I think.
Dr. Krutik, what is your experience with the so-called mother tinctures which are commonly used in renal calculi like Berberis vulgaris, Osmium sanct, or Sarsaparilla or Hydrangea? All these colchicum, all these mother tinctures, do you use or you are son of animal and don't use?
No, I definitely use, sir. In order to manage the acute attacks, mother tinctures are wonderful. And I am using it with profound satisfaction.
Fantastic.
Because once the medicine is clear, it is working well, it is moving the stone. What we need is to manage the pain, because the medicinal stone will move there. The pain will be only there if the stone moves. So that is the time for, I would say, an opportunity to break the stone or to make it out through the urinary tract. So I have wonderful experience with Berberis vulgaris and hydrangea, but I still remember an acute case of severe vomiting with urinary colic got settled with osimum care.
Fantastic,
So
fantastic.
I am a regular user as well as promoter of brother teachers in order to settle an acute episode, especially when the case is doing very well with constitutional medicine.
Fantastic.
I will
fantastic.
advise always, I will advise a patient not to have beer. It is better to have Berberis vulgaris.
Yes.
Anyway, that's good. That's good. Anyway, he's spending for berberis. Why should he spend for beer again?
So that is the commonest advice which every patient gets, that just drink beer one after one and then you will get out of it. But that actually causes more and more problem with the calculi.
Yeah, please. Sir.
Because
Actually, Pradeep.
Because see, everything is big, large, huge, and king size nowadays, as Dr. Krutik was saying. So life is like king size in the new mantra of next generation. And what does it mean? They think of themselves only. They will indulge. They will have Coke, 4 Cokes, or they will have beer. But this is going to cause problem. This is very important when we are treating cases of renal calculi.
Yes, exactly. I'll tell you one small example. Like or Krutik and Pradeep also mentioned about acute colic. One patient came rushing into the chambers without waiting for his turn and said, "Doctor, please do something. If you don't give me medicine immediately," he was almost like tremendously anxious, nervous. Nobody, it is severe colic, and who will be calm and quiet? And he said, "If you don't give me medicine which gives me relief in 5 minutes, I am going to die in 6th minute." Then I called Aconite and gave those 2 drops on his tongue.
Very nice.
And then he became all right in 1 minute or so. And after 5 minutes, he passed stone. So this is all like, but of course he had to be treated later. His drug of choice, according to his constitution, was sulfur. Now I'll ask Krutik, do you have such wonderful memories of acute prescription basing on one characteristic feature?
Yes, sir. I have. To your point, acute, the aconite and sulfur are having acute and chronic connection. So it was a master prescription from you. Eventually turned out to be a wonderful result. I have two, three memories. One of the strangest of stone I have observed is that whenever patient had stone, either he used to develop cystitis or a kind of an infection, which according to the doctor, probably it is a stone-borne infection. So there is single remedy, that is Ua Ursi. I tried that. I had given constitutional medicine, but it was not producing the magical effect what classical homeopathy is all about. But the single remedy is single rublik is Ua Ursi. So out of curiosity, and it is addition by Kent or Fatak, if I am correct. So then I gave that medicine, and to my greatest surprise, that patient has never developed stone and no infection in the genitourinary system. That was my real surprise.
Fantastic.
Second case was osimum Kent. It was like a new consultation. I have never seen that patient anywhere earlier. Just came with a severe pain in the abdomen. I was not even, I had to identify where this pain is coming from. It is an acute abdomen or whatever differential diagnosis. Eventually, it turned out to be a urinary colic. And to my surprise, if the patient had vomiting also, I gave osimum Kent directly in the liquid, the 1 potency on the tongue. And to my surprise, within 3 to 4 minutes, the patient started showing an improvement. And within 15 minutes, the patient was almost free from colic.
Fantastic.
That is,
Fantastic.
I can say I have never seen such kind of result in my life. Very few.
Thank you,
Like-
thank you. Pradeep, can you
I will
share?
add one case which is very interesting because just he has said about the cystitis case. It was a very nice case. Means I was actually not aware of this medicine for a long time, or I have never studied. But it was a case of a pregnant woman who came with a very severe colic, which was related with her renal colic. She had that, but it was silent, and she was on some medicines. I don't know. But when she came to me, then she was pregnant. And with that, she passed actually 1 to 2 stones or so. Still, she was passing, and then she developed cystitis. And then naturally, I have tried medicines, Cantharis or some 1 or 2 medicines, but she was not getting proper relief. So when I went again to Boric, and then really it was to my surprise that Boric has given a very important medicine. It is the cystitis, which is in cases of in pregnancy as well as from operations. There is only one medicine, that is Populus T. I was knowing Populus canadensis, which is a very good medicine for hoarseness, acute hoarseness of voice. But this Populus T, I could get it from somewhere, and with that she got relief.
Fantastic,
This was a
fantastic.
very
This is
nice
a,
case,
this is a
and-
new drug, new drug.
Yeah,
Populus
yeah,
T is a
and,
very good drug, very good.
and we if we go through repertory properly,
Mm.
then definitely we can get such medicines which are pinpointed only one medicine, and that you can give.
Now I will put a question to all three of my panelists, Asrani sir, Pradeep and Krutik. The other day I was in National Institute of Homeopathy, Kolkata, where Dr. Girish Gupta from Kolkata, from Lucknow, he presented a paper about renal calculi, right? And his research paper, which was published also in a peer-reviewed journal. What he was mentioning, like, first Asrani sir would answer, then Pradeep, then Krutik. He said, depending on the location of the stone in the kidneys, like calyx, upper calyx, middle calyx, lower calyx, we can meddle with these stones, and if it is upper or middle, they are amenable to our treatment. Lower calyx stones, it is difficult to treat them, number one. Number two, ureter stones are easily treated except at the UV junction. Number three, urinary bladder calculi are very difficult to be treated, though it is nearer to the urethra. Now, sir, from medical point of view, medicine point of view, is it true, these observations? That is his clinical observation.
Yes, all are true. And, you know, I would have suggested when the surgery is mandatory,
Right.
all of the three homeopaths here will agree that till now, no remedy has come which will allow a stone to go against gravity and come out in the pelvis.
Right. Exactly.
But
exactly.
there will be some spasm, no, sir?
No, see, it's a calyx. There is
Calyx,
a lot
yeah,
of space.
right.
So the stone remains there, and that stone is to be operated by a nephrolithotomy, a window from the back and go in.
Right.
Ureteric calculus is very easy to treat. Why? Because if it is 9 mm, all you have to do is make it 7 mm and it will flow into the bladder. UV junction though is like
Stuck.
magic. No, it's just sitting there, darwaje pe, open, just open the door. And bladder stone, generally by the time they are diagnosed, no, they are huge. So I don't think you can expect them to get dissolved and pass through the urethra unless you surgically crush them into sand and then let it pass.
Lithotripsy.
Absolutely right. All three are right.
Thank you.
I do agree
Pradeep.
with that. I do agree with that. But what is most important is ureteric calculi. It is like a mini delivery. They are already half, they have come through the way, and it is just, we have to push them ahead. So Berberis vulgaris, as Dr. Krutik has rightly said, it works very nicely. And as Dr. Asrani said, if it is 9 mm, we have to make it 7 mm. Berberis do that work very properly. And it just throws it away. And if you can say that right ureteric calculi, oxymum canum is wonderful medicine. And if it is left hydrangea, it works magically. I have treated many cases where they are halfway or even at the U junction. If you actually repeat Berberis vulgaris, then they will come out definitely. And when it is in the bladder, it is definitely, even Dr. Hanuman has said that when it is a cavity and if there is a stone, then it is very difficult that we can treat it because our medicines are not going to reach at that point. So this is absolutely all the three things which Dr. has said.
Girish Gupta, right.
Girish
Now,
Gupta said.
now, Dr. Pradeep, you said right side calculus, you said rightly, but to add to it, sarsaparilla with clear urine and the other drug like lycopodium, calcarea, those are all different drugs because at a constitutional level, but we are not talking that. Berberis vulgaris is also second grade in repertory for right-sided
yes.
renal calculus.
Yes,
It has that
yes.
capacity, so it is not bound by the location.
Right.
It has so
I do agree
many
with that.
qualities, actually.
Whether it is right or left,
Right.
you can
Dr.
prescribe it.
Krutik, what is your opinion about these 3 points, what I just mentioned about Dr. Girish Gupta's presentation?
Sir, I understand and I agree to the points raised by Dr. Girish Gupta, sir, but ultimately individuality plays a major role.
Right.
It is his individual clinical experience and conclusion what he has come up with, which we respect. But I have also some cases, documented cases in which lower calyx stone also medicine is able to throw them from the body with a very good effect. So it is again an individuality. But to my opinion, lower calyx stone usually are difficult to eliminate. That is for sure.
That's it. We agree.
They take more time. They take more time to get dissolved.
Bladder one.
Sir, actually, I had one very funny incident of my patient, which I realized that I was treating wrongly this person, and I turned out to be, I told him to go for sonography, and eventually turned out to be bladder calculus. The patient had extramarital affair, and he had some good time with the other one for some days, and 3-4 days after he came with a split urine, split urine.
Oh yes, stricture.
So patient said in complaint that I have split urine. So we usually, some kind of infection, etc., etc. I was thinking I gave him Medorinum for 2 days, no effect. Then he said I'm doing burning also with high sex drive. He usually has. So Cantharis was given with no effect. And then I told him that since I'm not able to help you out in a span of 4 or 5 days, which is very rare in acute situation, you go for investigation. And the patient turned out to be, a good size bladder calculus.
Oh.
And that split urine was because of bladder calculus.
Oh my God.
So that was a very strange experience I had clinically.
Dr. Asrani ji, you wanted to add something.
If you are thinking of bladder calculus, no, think of a paperweight, and that is how a bladder calculus is.
Oh my God. No, I had 3 cases of bladder calculi. Actually, they had HIV along with bladder calculi. I have treated on different scale, different characteristic features, and this became secondary. In fact, they, as Dr. Asrani rightly put it, they were painless. So they were not bothered about it. It is only an accidental discovery that this fellow had, because all investigations were done and this was done. And one among them, I tell you, one among them was treated with Medorinum, as you have treated, because he was a crook of crooks and he got the beautiful disease also. So that Medorinum helped him to recover, and his CD4 became above 500, viral load became 0, below detectable limits, target not detected. So he is still under treatment, and his calculi became almost like chura. He passed. One more thing I wanted to ask all 3 of you, because this is common. They have the tendency to pass. I have one patient. I had one patient, and you won't believe, every month he used to bring 4 or 5 calculi caught in a bottle and give me. Series, like it is like series, those series what we see on OTT. Every time he passes, so frequently he was passing these stones. Sir, what is your advice, Dr. Asrani ji, to this man? He underwent lithotripsy 3 times earlier. right side 2 times, left side 1 time, but it has been forming. It is like a quarry. He was forming stones regularly.
See, most of these people know who form stones which come out without trouble are not interested in doing any detailed investigation. This person ideally should be investigated with a detailed metabolic profile and suggested diet, etc., because his body is depositing calcium oxalate and urate.
Yeah,
all.
it was calcium oxalate only, sir.
Yeah, so then why it is doing? I think these people, it's like, they laugh. When you tell them, no, arey, kuch kar lo test. Arey, sir, mine passes, no? So why worry?
No, but
So they
this man,
think they
sir,
are lords,
yeah,
My
this
stone
man,
passes.
sir, sorry to interrupt you. I add here for this man, I am giving example of this man, but I wanted you to throw more light on these patients. This man is a known diabetic, and he got investigated thoroughly by a very famous urologist here in Hyderabad, and nothing has been found. He said, when you are passing painlessly stones, forget it, take plenty of water. And I will also come back to you about the diet. This urologist suggested every day you take 1 glass full of either lemon juice or orange juice or sweet lime juice. That counters or calcium oxalate. That part we will discuss later. But at this point, I would like you to talk about this tendency. What would we do for this patient, for such patients?
See, with due respect to all our researchers and scientists, there's a lot about medicine we don't know.
Of course.
So I would say this is a case where I shrug my shoulders and say, if you have no symptoms, if it's not affecting you either in acute painful way or it's not getting blocked, let the nature take its course.
Right. Pradeep, what is your opinion?
Definitely. But we have got some major role to play in this. Because of all the metabolic problems, we have to treat such patients with some liver medicines if we want to treat them very specifically. So along with the constitutional medicine which the patient is having, I will like to add some liver medicine, specific liver medicines like chelidonium, so that the metabolism of that person will get better.
Krutik,
Yes, sir.
what is your opinion about these people who have a factory inside?
Sir, there is a definite rubric that is constitutional lithemic or lithic acid diathesis, which means continuous development of stones. So that is the key here, which I would like to take for my prescription, to base my prescription. And along with organon, you need to break the recurrence. That is only possible with antisoric. So that is antisoric, radical antisoric care, what Hahnemann has given for one-sided diseases. And that is what my approach will be here in this case. And probably the remedy which comes on the top usually is lycopodium, sulfur, sorinum,
Calcarea.
calcarea. All these are the drugs usually come forward, and it has produced good effect also. The recurrence of the stone has been reduced to a great degree.
Yeah, I'll add to this gentleman's case, as I have raised that gentleman's case. He was on calcarea carb 0/1, 0/3, 0/6 like that. And he was much better, but yet he was passing stones, but in less frequency. What happened 6 months back, he had to undergo some investigations which showed some changes, then led to CAG investigation. Then stunt was also placed because they have found calcium deposits in coronary arteries, especially RCA, without any serious symptoms. He was having these things. So that also, like Dr. Asrani was mentioning, that there is a basic problem with calcium metabolism in this body, but we couldn't throw any light on that. But we have put him on calcarea carb. Probably it could not prevent him, but at least I am a little happy, satisfied that this man is happy. It was only an accidental discovery and he is now alive and he is absolutely all right. These things can happen. But anyway,
we can add Artica urens in this case, where Porik has very clearly mentions that it actually the progress of this formation is it is always
Fantastic,
better with
fantastic.
cardiac.
In fact, our
Yeah.
Vaishali, Dr. Vaishali added Phyllanthus niruri also is one of the
Mm.
beautiful remedies, which is also
Mhm.
very useful. Now, as we are coming to the end of our roundtable, and we had wonderful discussion about renal calculi, and it would be throwing light on them. And as Swami Chinmayananda tells at one point, our panelists are teachers. They are like signposts. They will give you guidance. It is up to you to select and the right pathway and go ahead. Now, before we conclude, I request all three panelists to throw light on the diet and other suggestions to each of your renal calculi patients, though we touched upon saliently, but just to conclude it. Asrani, sir.
So there are a lot of myths which pertain to calcium, I mean stones. Calcium is bad, it is said. No, calcium is not bad.
Needed.
So my patient, I will not stop anything totally. I will say oxalate rich foods are spinach, other leafy vegetables, and sweet potato.
Cabbage, cauliflower, any problem?
Pardon?
Cabbage and cauliflower,
No,
people talk about it.
no. So
Hmm.
what I will tell my patients, if you're taking oxalate foods, no, you take calcium together. So in the intestine, they form calcium oxalate, which passes through the stool. It does not reach the kidneys at all.
It's
Yes,
fantastic
maybe
advice.
also Dr. Thorat. Then I will say, whatever you eat, 2.5 to 3 liters of water is a must.
Fantastic.
For people who have uric acid stones, I will say organ meat and red meat should be curtailed.
Right.
And then when you are eating red meat, make sure you are consuming 200-gram bowl of curd at least. And I want everything to go out, but
Yeah.
nothing should be this thing. And Dr. Praveen, what you said no about lime juice, sweet lime juice and all, if the urine is acidic, uric acid stones have a higher chance of formation. So people who have uric acid stones, I will say you may have citrus fruits, but no juices and no lime juices.
Acha, only fruits. Yeah. Thank you.
This is my perception. Nothing is to be stopped. And as I said initially, no seeds are going to be going to kidneys.
Right.
It's
Thank you.
calcium oxalate and uric acid. That's all.
Thank you. Dr. Pradeep, one quick
Yeah,
roundup
most
now about
important general preventive measures which we have to take care. Number one is fluid intake. We have to have minimum 3 to 4 liters of water
right.
consumption by the patient. Number
Right.
two, which we don't give importance. The patient goes and do some gym, and he has a more excessive fluid loss in the form of sweat. So
Like
fluid loss
dehydration.
should be monitored properly. And thirdly, the lifestyle advice, that is also very important. You have to maintain your BMI between 18 to 25 kilogram per meter square. That is most important, and it is not applicable to children, of course, but along with that, stress limitation, that is also important if we want to treat the patient properly. So fluid intake, nutritional advice for a balanced diet, and lifestyle advice, these three things will have a major role while we are treating a calculi
Thank you.
case.
Thank you, Dr. Pradeep. Krutik, winding up.
Yes, sir. With due respect to the advices given by the panelists, I am of an opinion that no advice should be given. Only a remedy should be given with a critical watch for the first 3 months. Because if you give advices and a patient has improvement, which has worked, remedy has worked or the advices has worked. So for first 3 months, what I do for my patients is that I take the report, maybe sonography, and for first 3 months, I tell them whatever you want to do, you do. Let me have the effect of the remedy. And the first 3 months, usually I am able to see the stubbornness of the case. If there is an improvement, automatically the remedy will correct the disturbed metabolism or whatever it is inside the body. If there is a stubbornness I'm able to see or a kind of leaking acid diathesis, then the advices can come step by step. Otherwise, advices will work or the remedy has worked. It will be a very dubious state.
Thank you, Dr. Krutik. I really appreciate you in differing and telling in a different manner. Thank you very much. Now, कुछ भी होने दो, जो पत्थर है, या तो वो किडनी में है, या पत्थर के सनम है, जो भी है, वो अपने लिए अच्छा नहीं है. So now we will call it a day. I thank all my panelists and my NJH team and all the people who have attended. Thank you very much. Good night. See you again.
Thank you.
Thank you.
Thank you. Thank you.
Thank you, Dr. Praveen. Thank
Thank
you,
you, sir.
Krutik
Thank you.
and
Thank you, sir.
Pradeep.
Thank you.
bye.
Thank you. everyone.
Thank you,
Thank
sir. Thank you.